Okay, good afternoon. It is still Wednesday, March 29th. You should have in front of you a couple of things, but we're going to start with the yellow document on your desk that is titled Voting List Number 24. And we're going to start with Nathan's bills. Good afternoon, Nathan.
Good afternoon. The first bill on the list is Senate Bill 966. This is a bill that was heard just last week. As amended and shown in the reprint, the bill establishes a work group on health and wellness in Prince George's County. By December 1 of 2024, the work group must produce a report of its findings and any recommendations. There's one amendment. It adds a member to the work group and requires that the Prince George's County Health Department staff the work group. There is no fiscal impact and there was no opposition at the hearing.
Have a motion and a second for a favorable on Senate Bill 966 with the amendment. Are there any questions? All those in favor, raise your hand. Seeing no opposition, Senate Bill 966 as amended receives a unanimous favorable report. Next bill.
Next bill on the list is House Bill 121, which as amended and shown in the reprint, codifies existing regulatory requirements, including time periods for and who must participate in the development, review, and reassessment of a patient's plan of treatment. The bill also establishes new requirements relating to a patient's plan of treatment, including an opportunity to involve family members and other individuals, and a process to request that a healthcare facility review and reassess the plan. The Department of Health is required to adopt regulations to establish a process for appeals and reconsideration of reviews and reassessments for patients admitted to state facilities. And beginning in 2024, they're required to submit a specified report by January 1 each year. There's one amendment and it corrects COMAR citations that can be found on page 8. I've been told that the concerns of all parties were addressed by the House amendments, and those entities were MedChi, the Judiciary, the Mental Health Association, the Hospital Association, and the Department of Health.
So just to clarify, this is House Bill 121 that we're looking at first.
And next on the list is Senate Bill 8, which is the cross file, which will have amendments to conform it to House Bill 121 as amended here before you.
Okay, got you. I was like, why are we doing the House bill first? But we need to do this one and then amend the
You can take them in either order. If you'd like, I can explain Senate Bill 8 and the House amendments in more detail.
And then it's going to be the same bill?
And it would be the same.
Then we can do one vote for them. So yes, please.
Very good. So in that case, Senate Bill 8 as amended is identical to House Bill 121. And as I mentioned, codifies existing regulatory requirements related to the development, review, and reassessment of a patient's plan of treatment. Bill also establishes new requirements relating to a patient's plan of treatment, including an opportunity to involve family members or other individuals, and a process to request the healthcare facility review and reassess the plan. So the amendments shown in the reprint require the facility to provide a schedule of team meetings where a plan of treatment is going to be discussed, and establish a process for authorized individuals. And those would be individuals who are identified by the patient to participate in treatment team meetings when the individual consents to the inclusion of family members to participate in the development of the treatment plan. And so the bill as amended also provides for the circumstances when a treating provider may withhold information on a treatment plan from a family member. They alter the process to be followed by a facility when communicating the results of a review and reassessment of a treatment plan. The amendments also strike an Office of Administrative Hearings review from the bill, and instead requires the facilities to provide referral information for the residents' grievance system, and further authorizes certain individuals to appeal reconsiderations to the Department of Health's Healthcare Systems Chief Medical Officer, and requires the department to report on the residents' grievance system.
Okay, thank you, Nathan. So we have in front of us Senate Bill 8 and House Bill 121, which as amended would be the same bill, just the exact cross files with our amendments.
Precise.
So are there any questions about the amendment or the bills? I will entertain a motion for House Bill 8 and, I'm sorry, Senate Bill 8 and House Bill 121. I have a motion for a favorable. Is there a and a second? So Senate Bill 8 and House Bill 121 as amended. All those in favor, raise your hand. Those bills receive unanimous favorable reports as amended. We'll move to the next bill.
House Bill 140 as amended is identical to Senate Bill 136, which passed the Senate unanimously earlier this session. The bill limits the amount that the Secretary of Labor may deduct from weekly benefits payable to an unemployment insurance claimant when recovering benefit overpayments that are unrelated to fraud. The amendment, as shown in the reprint, delays the effective date in line with the Senate bill.
Have a motion and a second for a favorable on House Bill 140 as amended. Are there any questions? Seeing none, all those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
The next bill, House Bill 242, as amended and reflected in the reprint, is identical to Senate Bill 216, which passed the Senate unanimously earlier this session. The bill removes treatment of illness, disease, and injury from the definition of what massage therapy does not include. The bill also repeals language specifying that a nonprofit health service plan insurer, HMO, or third-party administrator is not required to reimburse a licensed massage therapist or a registered massage practitioner for services rendered. The amendments, again, align this bill with the Senate bill, and it delays at the request of the board, the date by which the board must stop issuing registrations to practice massage therapy.
House Bill 242 as amended to be the same as what we passed out of the Senate. Have a motion and a second for a favorable on House Bill 242 as amended. All those in favor, raise your hand. That bill receives a unanimous favorable report. We'll move to the next bill.
So the next two bills are, as was the case with the treatment plan bills, cross-filed bills. There's both the House bill with the amendments that were passed in the House and no additional amendments, and then the Senate bill amended to conform to the House bill. So addressing very briefly first the House bill, House Bill 273 alters educational and experience requirements for applicants seeking licensure as an environmental health specialist and alters the grounds for which the State Board of Environmental Health Specialists may take disciplinary action. I've been informed that all parties were satisfied with the House amendments and the bill passed the House unanimously. Turning to the reprint of Senate Bill 399, as amended, previously mentioned, it alters the education and experience requirements for applicants seeking licensure and alters the ground for which the board may take disciplinary action. The amendments remove from the bill proposed language altering the definition of practice as an environmental health specialist, further removes from the bill proposed new language that would have authorized the board to approve an examination provider to administer the examination, further removes from the bill proposed new language relating to final decisions and orders of the board, and finally changes the effective date of the bill.
Okay, so we have before us amended Senate Bill 399 and House Bill 273 to put them in the posture as adopted by the House that we believe have addressed the concerns that were raised when the bill was introduced through the amendments.
Move favorable.
Have a motion and a second for a favorable on Senate Bill 399 and House Bill 273. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. We'll move to the next bill.
The next two bills are similarly situated with the House bill and including amendments and the Senate bill amended to conform. Let me just see here. And so for the sake of brevity, I'll just read from the Senate bill again, which is amended to conform with the House Bill cross-file. Senate Bill 772 as amended authorizes a licensed certified midwife to delegate a technical task to an assistant. It authorizes a licensed certified midwife or a licensed certified midwife to personally prepare and dispense a starter dosage of a drug. It eliminates the requirement that an applicant for a certified midwife license complete specific coursework in health and sciences. It alters the definition of practice certified midwifery, practice nurse midwifery, certified medication technician, and certified nursing assistant. Bill further adds an exemption to the licensure requirement to practice certified midwifery, authorizes the Board of Nursing to appoint peer advisory committees to provide advice related to midwifery, requires the board to further develop regulations governing the delegation of technical task by licensed certified midwives to assistants, and requires the Department of Health to submit a report on recommendations to expand access to birthing centers in the state. So the amendments make a number of technical changes, further clarifies the definition of certified medication technician regarding the tasks performed by a medication technician, and the definition of certified nursing assistant to clarify that practice is subject to the regulations adopted by the Board of Nursing, and then clarifies the education required for an individual to be exempt from requirements to be licensed as a certified midwife. There is no fiscal impact, and again, my understanding is the House amendments address all of the specific concerns raised by the Board of Nursing, and they're favorable with amendment testimony submitted on both bills.
Thank you. Senator Beidle.
Thank you, Madam Chair. So we passed a bill yesterday about the Board of Nursing being reconstituted. Does passing this bill in any way conflict with that bill? Thank you.
Not directly. I don't believe that the requirements of House Bill 611 and Senate Bill crossfile would conflict with the requirements that the board, for example, develop regulations under these bills.
Are there any additional questions? Okay, we have before us as amended Senate Bill 772 and House Bill 715. There is a motion and a second for a favorable on those two bills as amended. Seeing no questions, all those in favor, raise your hand. Those bills receive unanimous favorable reports with amendments. Next bill.
Moving on to page 2 of the voting list, the next bill is House Bill 781, which is identical to Senate Bill 699, which passed the Senate earlier this session. The bill establishes the Equitech Growth Commission and Fund in TEDCO to support economic competitiveness and inclusive growth of emerging and advanced industries in the state. TEDCO must staff the commission, which must develop a report on a strategic plan and 10-year goals by July of 2025. For each fiscal year, 2025 through 2033, the governor must include an appropriation of $5 million for the program in the annual budget bill.
Okay, are there any questions? I'll entertain a motion.
Move favorable.
Have a motion and a second for a favorable on House Bill 781. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. Next. Oh, thank you, Nathan. You're done. We're going to Patrick. Good afternoon.
Okay, so House Bill 9 is substantially the same as Senate Bill 19, which the Senate passed earlier this session. This is the bill that requires the Department of Transportation to conduct certain transit equity analyses. The bill needs a technical amendment to correct something in a provision.
Senator Mounts would like to know what that means.
But there was a word that was missing. Disability was missing from a provision. So.
Okay, so we have House Bill 9 before us, which is a cross-file to Senate Bill 19, but with one correctional technical amendment.
Move favorable.
Have a motion and a second for a favorable on House Bill 9. All those in favor, raise your hand. That bill as amended, nope. That's those in favor, raise your hand again. Okay, those opposed, raise your hand. That's 2. So that is a 8-2. That bill as amended receives a favorable report. We'll go to the next bill.
House Bill 37 is similar to Senate Bill 90, which the Senate passed earlier this session. The bill, the Senate put on an amendment that exempted non-commercial solicitation for the purpose of public opinion research from the restrictions in the bill. So an amendment would be needed to conform the House bill to the Senate bill.
Move favorable with the appropriate amendment, put it in the same posture as the Senate bill, please.
Only.
Second.
Okay, I have a motion and a second for a favorable. I just wanted to ask, did anybody else start getting more spam calls after we passed this bill? I did, seriously. Okay, so they know they're listening. Okay. So we have in front of us House Bill 37 as amended. All those in favor, raise your hand. That bill receives a unanimous favorable with amendments report. Next bill.
House Bill 376 is similar to Senate Bill 184, which the Senate passed earlier this session. It prohibits health insurance carriers that provide coverage for a diagnostic breast examination or supplemental breast examination from imposing a co-payment, co-insurance, or deductible requirement for such examinations. There was a technical change relating to high deductible plans that the Senate put on. And so the bill would need an amendment to the House bill to align it with the Senate bill. And also, I believe that the House is going to be adding on some study language that would require to the Senate bill that would require the Healthcare Commission to study and report on the financial impact, eliminating health insurance cost sharing for diagnostic image-guided biopsies for breast cancer. And then they would change the effective date up to accommodate the study. So I don't have a reprint for that, but that's the description of what the study language is. I understand that there's really no concern with that study. So that study language could go on this bill and it would align the bills.
With that here, Bill, and you're okay with conceptually? I'll entertain a motion.
Move favorable.
Have a motion and a second for a favorable with the amendments to House Bill 376. Senator Hayes? Oh, I thought there was a question. You ready to go? Okay, all those in favor, raise your hand. Okay, seeing no opposition, that bill receives a favorable report with the amendments. Next bill.
House Bill 548, this is the Access to Banking Act. It's similar to Senate Bill 550, which the Senate passed earlier this session. This is the bill that establishes initiatives to expand access to capital for businesses and individuals located in low to moderate income communities. There's the fund, and then there's also the credit to incentivize the location of branches in these areas. The House made some technical and clarifying changes to the bill, which the governor's office views as friendly. This would include expressly stating that the fund is an instrumentality of the state. Also would require the Commissioner of Financial Regulation to establish a governance structure for the fund instead of just authorizing the commissioner to do that. So those were two clarifying things that the House amended into the bill. So that's the one thing that's different, from the House bill from the Senate bill. And then there is one technical amendment that's needed to correct a citation error that's in the bill. So that amendment would need to be put into this House bill.
Okay. Senator Hayes.
Madam Chair, Patrick, did they retain, I know originally they had removed the MBWB requirement. We put it back in. They didn't touch that at all, right?
So they didn't touch that either. So we removed that, or so we had, yes, so we removed that piece of the bill and they did as well.
Got you. Thank you so very much. Appreciate it.
Okay, seeing no additional questions, I'll entertain a motion.
Favorable.
Have a motion and a second for a favorable on House Bill 548 with the amendments. Seeing no questions, all those in favor, raise your hand. Those opposed, raise your hand. That's 8 and 2. That bill receives a favorable report with 8 for, 2 against. For the low to moderate income community. Okay, next bill.
So House Bill 686, this is a bill that has no Senate cross-file, but was heard last week. This bill would modernize the current fee structure applicable to non-depository financial institutions licensed by the Office of the Commissioner of Financial Regulation. The bill generally eliminates the requirement that each branch location of a financial institution obtain a separate license or registration and pay a fee, and instead institutes a new regulatory system whereby each financial institution obtains a single license or registration and pays one fee that covers all of its branch locations. Under the bill, the Office of the Commissioner of Financial Regulation is authorized to establish an annual assessment that reflects, among other factors, the costs incurred in supervising the category of licensee and the type and volume of business that the licensed person conducts in the state. I don't think there are any amendments that are being offered. There was no opposition to this bill.
Senator Bidel.
So an example would be one of those check cashing places or? Okay,
Right.
just
that would be-
want to understand this. Thank you.
Any additional questions? I'll entertain a motion on.
Favorable.
Have a motion and a second for a favorable on House Bill 686 with no amendments. Any questions? Seeing none, all those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
House Bill 794 is substantially the same to Senate Bill 876, which the Senate passed earlier this session. It establishes the Baltimore Regional Transit Commission. That among other duties, the purpose of the commission is to provide input and engage in advocacy for the Baltimore region public transit systems maintained by the MTA, and then review and comment on service change reports and other transit-related plans and reports. There is a technical correction that was needed to the bill. And so that amendment just fixes something that was wrong in the bill.
Senator Ellis.
Madam Chair. So I remember the Senate version had the Baltimore Regional Transit Commission to approve the budget. Does the House version amend that? I think we amended that out, the Senate version. So the House version did that also, or do we have to do that?
Right, they're in the same posture.
Same posture?
Mhm.
Okay, great. Thank you.
Okay, we have House Bill 794 with a technical amendment. Seeing no questions, I'll have a motion and a second for a favorable on 794. All those in favor, raise your hand. 794. Those opposed, raise your hand. That is 8 and 2. That bill passes with a 8-2 vote. Next bill.
Senate Bill 814 is essentially the same as Senate Bill 601, which the Senate passed earlier this session. This extends the termination date of the state-based young adult health insurance subsidies pilot program for an additional 2 years. There was a fix that was needed to a function paragraph in the title of the bill. So this is another technical amendment that's needed.
Okay, you have before you House Bill 814. Have a motion and a second for a favorable on House Bill 814 with the clarifying technical amendments. All those in favor, raise your hand. That's 8. Those opposed, raise your hand. That's 2. That bill is passed. Next bill.
House Bill 815 is similar to Senate Bill 965, which the Senate passed earlier this session. The bill requires health insurance carriers to provide coverage for recommended follow-up diagnostic imaging to assist in the diagnosis of lung cancer. Once again, there was a technical correction that was needed to a provision. And so this amendment would insert some language that refers to co-insurance or deductible to align with some other provisions in the bill.
Okay, so House Bill 815 with technical amendments.
Favorable.
I have a motion and a second for a favorable on House Bill 815 as amended. All those in favor, raise your hand. That bill receives a unanimous favorable report with the amendments. Next bill.
House Bill 884, this is a House bill with no Senate crossfile that was heard last week. This bill authorizes but does not require Baltimore City to honor certificates of guarantee issued by a nonprofit association of contractors or its wholly owned subsidiary in order to satisfy certain city bond requirements. There was no opposition at the committee hearing to this bill.
Senator Hayes.
I'm sorry, I like this bill. It's a good bill, but wouldn't it require delegation approval?
I don't think we do. You're right. I don't think we have a letter from
No,
the
I
Senate
don't remember
delegation.
voting on it. Yeah, it's a good bill, though.
Okay.
I just want to make sure we process.
Okay, next bill. Yep, we'll hold that bill until we get the delegation letter.
House Bill 913, also a bill with no Senate crossfile, heard last week. This requires student financing companies to register with the Office of the Commissioner of Financial Regulation and provide annual reports about their practices. Among other items, student financing companies must report on the number of Maryland consumers who owe the company debt, the range of interest rates for the debt, and the default rates for consumers who owe the company debt. No opposition to this bill.
Senator Ellis.
And Patrick, so what is that student finance? Is that student loan financing?
Right,
Okay.
private
Private.
student loan
Okay.
lenders.
So not like the Sally's and,
Correct.
okay, thank you.
Okay, any additional questions? Entertain a motion
Move favorable.
and okay, I have a motion and a second for a favorable House Bill 913. All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
House Bill 111 authorizes, this is I don't know if I'd need a letter from, we don't have a letter from them. We do not have a letter from the county. Yeah.
All right, we'll move to House Bill 1150.
Mhm. House Bill 1150, this does not have a Senate crossfile, but it was heard last week. This adds a statutory definition of a shared appreciation agreement to Maryland law, confirming that these agreements are residential mortgage loans and subject to applicable mortgage loan laws and the regulatory authority of the Office of the Commissioner of Financial Regulation. This type of agreement is a transaction in which money is advanced to a consumer in exchange for an equity or other interest in their real estate or a future obligation to repay a sum on the occurrence of an event, such as the transfer of ownership, a repayment maturity date, or the consumer's death. The bill confirms the commissioner's authority to adopt regulations regarding the enforcement of and compliance with statutory provisions pertaining to credit grantors who offer or make these agreements, such as requirements relating to licensure, disclosures, and other consumer protections. There was no opposition to this bill.
Seeing no questions, I'll entertain a motion.
Favorable.
Have a motion and a second for a favorable on House Bill 1150. All those in favor, raise your hand. Unanimous favorable report. Next bill.
House Bill 1217 is similar to Senate Bill 805, which the Senate passed earlier this session. This is the bill that requires health insurance carriers and Medicaid to provide coverage for biomarker testing for the purpose of diagnosis, treatment, appropriate management, or ongoing monitoring of a disease or condition that's supported by medical and scientific evidence. There was a floor amendment that was offered on the Senate bill. And so an amendment would be needed to align the House bill with the Senate bill. And this amendment adds to the report that Medicaid is supposed to, the health department is supposed to conduct, to include in the report whether the amount of reimbursement for the testing should be capped, and if recommended, the cap amount and anticipated fiscal and access impacts from the cap. So an amendment is needed to add that to conform the House bill to the Senate bill, and there also is a technical correction that is needed to the bill.
Okay, we have before us House Bill 1217 with amendments to conform it to what we passed out of this committee, plus a cleanup technical amendment. Have a motion and a second on HB 1217 as amended. All those in favor, raise your hand. That bill receives a unanimous favorable report with the amendments. Next bill.
House Bill 1272, no Senate crossfile for this one, heard last week. It's House Bill 1272 is an emergency bill. It extends for an additional 2 years the termination date for provisions of law that require the Administrative Services Organization that administers the Medicaid Specialty Mental Health System, also known as Beacon, to comply, or Optum, to comply with certain prompt pay requirements. The bill also extends the authority of the Maryland Insurance Administration to enforce the prompt pay requirements applicable to the ASO and to conduct an examination of the ASO to monitor compliance with the statutory requirements.
Oh, okay. Have a motion and a second for a favorable. Are there any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. Senator Vital?
Just have a process question.
Sure.
So with all these technical amendments that we're putting on House bills, we'll pass them in the Senate. Will they have to go back to the House again to approve the amended bill? Okay.
Yeah, they will go
It's a
back.
shame. Okay, thank you.
Yep.
Sure.
Any
Yeah.
amendment? Okay, thank you, Patrick. Are you done? You don't have any more technical, small little amendments? Okay, we're gonna go to David. Thank you.
You're done with the yellow sheet. This blue sheet is consent calendar of all identical Senate and House bills. They passed the House or the Senate unanimously, so they are on a consent. I think, well, hold on, before you go, I think Senator Hayes has to make a correction here.
Hey, Senator Hayes.
No, thank you, Madam Chair. I had a chance to speak to David about House Bill 909, which is my cross file. There's some amendments that we need to make to this based off of some information that we got from OPEG. So I want to work with David to make that change before we move this one forward. House Bill 909. Yeah, it was the cross file to my appraisal bill.
It required a study, and the study apparently is not constitutional. It has something to do with separation of powers on how the General Assembly is making the executive branch pay for something that it's very technical.
Okay, so we're carving out House Bill 909. Senator Mouse.
House Bill 489.
$49 is what on this list?
Oh, sorry, that was from our hearing schedule. I got the wrong, I'm looking at the wrong paper. So I've got a list of like, don't do your first term, so that one makes the list. I apologize.
Okay.
So no, everyone really take a look at the blue sheet.
Yeah.
Knowing we've already held 909. Any other questions, reservations, hesitation? They are
They're
all
all-
unanimous cross files that we've already passed unanimously.
Yeah,
Yes.
they're all unanimous. That's, or else they wouldn't be on this list.
Actually, Senator Carson.
This should be green, I think, for go.
my cross files on here.
Oh, well, what are the numbers?
I don't
No,
know.
I'm kidding. I'll entertain a motion on this consent calendar. Have a motion and a second for a favorable on the voting list 21, except House Bill 909. Seeing no questions, all those in favor of this consent calendar, raise your hand. Unanimous again. All right, that concludes our voting for the day. Tomorrow we have bill hearings again, and we'll probably vote a few more bills, but we have a very short hearing schedule. Enjoy your evening, Vice Chair.
Want to remind everybody down in my office is NCS